Welcome to week 13. Let's talk about muscles. Now let's talk about the functional groups of muscles. So first we need to talk about the action. So the action is the effect produced by a muscle to produce or prevent a movement. So we have four categories of muscle action. We have a prime mover, we have a synergist, and an antagonist, and we also have a fixator. So what is a prime mover? So a prime mover is the muscle that produces most of the force during a particular joint action. And we're going to go over an example of all four of these. A synergist is a muscle that aids the prime mover. So it's going to be aiding this muscle up here. It may contribute additional force, modify the direction of movement, or stabilize a nearby joint. So now we're going to talk about an antagonist. So a prime mover is also known as an agonist. So an antagonist is going to oppose the prime mover. So if you're antagonizing me, you're going against me, you're annoying me or something like that. So this is going to go against that prime mover. So it's going to prevent excessive movement, sometimes relaxes to give the prime mover control over an action. An antagonist pairs muscles that act on opposite sides of a joint. That's what an antagonist pair is. We also have a fixator, which is a muscle that prevents movement of a bone. We're going to go over that as well. So let's take a look at an example here. So the prime mover of elbow flexion, bringing the radius and ulna up here, decreasing this angle here, is going to be the brachialis muscle. That is the prime mover of elbow flexion. Therefore, the biceps brachii is going to be a synergist. So prime mover, also known as agonist, and then synergist right here, the biceps brachii. Therefore, the antagonist going against that agonist right here is going to be the triceps brachii. So that would be your antagonist. Now we have another term, because we had four terms. The fourth term we had was fixator. So the rhomboids are going to attach to the scapula here, and they're going to secure the scapula to the spine, to the vertebral spine. The spine would be right here. You can't see the rhomboids, but they would be here and here, major and minor. They would stabilize. They're stabilizers, fixators. They are going to stabilize that scapula, that bone, so that when the biceps brachii pulls on the scapula, it's not going to pull that bone too far laterally. Now let's talk about muscle innervation, and this is kind of a preview to the nervous system, but it illustrates how the muscular system and the nervous system are intimately connected here. So innervation of a muscle refers to the identity of the nerve that stimulates it. So knowing the innervation enables diagnosis of nerve, spinal cord, and brainstem injuries from muscle tests. So what does that mean? So for example, if we were testing muscle flexion, so if you had a patient flex their elbow, and if that was, say, weak, we would want to see what's going on with, specifically we would want to know what nerve innervates the biceps brachii and also the brachialis muscle. So those are the flexors, the anterior flexors of the arm. So we'd want to know what nerve innervates them, and actually that would be your musculocutaneous nerve innervating that biceps brachii. So we would trace that. Up here we have the musculocutaneous nerve, so we would trace that back to the spine, and we would see that C5, C6, and C7. Those nerve roots are supplying that musculocutaneous nerve, and these are the spinal nerve roots. So these are coming out at the spine, and if there is any obstruction there, maybe we have a disc herniation that's putting pressure on these nerve roots and cutting off a lot of that supply, which can cause not only numbness, tingling, pain, but also actually weakness. If it gets more severe, it can actually cause weakness as well. So you can actually be, I mean, it's fascinating that we can figure this out, but it's a valuable tool, and it's pretty neat, really. Spinal nerves arise from the spinal cord, like I said, merge through those intervertebral foramina, and if there's any pinching of that nerve, whether that's from the intervertebral disc, or maybe we have some osteophyte formation, some bone formation, bone degeneration that is compressing, putting pressure on that nerve. That can cause problems. Immediately branch into posterior and anterior rami, innervate muscles below the neck. Plexus is a web-like network of spinal nerves adjacent to the vertebral column. This is your brachial plexus here. So this is your brachial plexus right up here. We're going to go over a few other plexuses. That'll be in the nervous system unit. But so that's a great example of how the muscular system and the nervous system work together. So let's talk a little bit more about muscle innervation. So the cranial nerves can actually innervate muscles as well. So for this example, we're using the accessory nerve, cranial nerve number 11. It's going to innervate the SCM, the sternocleidomastoid mastoid, and actually the trapezius as well. So to test the cranial nerve number 11, we can actually have the patients shrug their shoulders. So that is testing that trapezius muscle, which is innervated by the cranial nerve number 11. So here are some tips that you can use for learning the muscles. So examine the models, cadavers, dissected animals, or photographic atlases. So since we are virtual, you're going to want to use A&P revealed. So you can type that in on your computer, do a Google search, A&P revealed. You can log in, and through McGraw-Hill Connect, you actually have access to A&P revealed. So if you type in A&P revealed on Google, and then you'll click you'll figure out how to navigate down to, it'll say login, and you can actually go into that. If you have any trouble with that, let me know. But since you have McGraw-Hill Connect, you have access to A&P revealed as well. And that is a virtual dissection. Like, they have cadavers loaded up, they have models, they have animations, all of these fun resources that are going to help you remember and understand these muscles. Also, you can palpate yourself. You can feel a lot of your muscles. If you flex your arm, you can feel your biceps brachii. If you do a tricep kickback, you can feel that. You extend your elbow, you can really feel your triceps. Locate the attachments of the muscles on an articulated skeleton. You could do that on A&P revealed. You can feel some of the where the tendons are going on yourself. Study where the muscle's name is derived from. Usually describes the muscle's location, appearance, attachments, or action. And then you can say the names out loud to yourself or to study partner, and you can work on spelling them correctly as well. Let me know if you have any questions. You shoot me an email. That's usually the best way to get a hold of me. But yeah, good luck. Let me know if you have any questions.